Well, hello, I'm Dr. Gary Huber, and this is my colleague, Chelsea Dorsett. We want to talk to you about corporate health. Yeah, boring, right? Corporate health initiatives, if you think they're a waste of time, you're not alone. We think they're a waste of time too. That's why we changed it. We turned it upside down. The old model doesn't work. Just identifying that George has high blood pressure and putting him on medicine, it doesn't make George healthy. That's what we're about. We want to come in and actually make your employees healthier. And I know your first question is, what's it going to cost and what's the bottom line? I want to talk about return on investment because that's really critical. So, return on investment.
The biggest thing you'll notice is the prescription costs decrease significantly.
How is that possible?
How's that possible? We're not even acting as their primary care physician, but when you get healthy, when you change the physiology, the need for blood pressure medication or metformin, that all goes away and decreases significantly.
So for those that are wanting and willing to make change, we engage them weekly accountability, education, outside the office events to change their lifestyle. And when they change their lifestyle, all of a sudden their blood pressure, their heart rate, their blood sugar, their CRP all goes down.
Dr. Huber and Chelsea are teaching the right program, and I can tell you our success and we're changing lives, we're changing families, we're changing it all. And it has just blown me away watching the results because I came out of that standard health care.
One of the most powerful things we do inside of a corporate health of engagement is we create a group. We select a subset of patients with metabolic syndrome that are wanting to make change.
About 5 years ago, when we started doing these small groups, 12, 15 people, it was magical. Seeing these groups come together, and there is a strength in numbers. There is a strength when 3 people are doing well, everybody else wants to do well. So it's something that you cannot recreate one-on-one, and it is, like I said, the only way I can describe it is it's magical. It's powerful.
Well, there's an intensity inside of a group, and when you get that mindset, that pack mentality, it's amazing the change it creates.
Yes, I think you nailed it. It's that Pac-Man mentality. And on the flip side, if you're not doing well, you're looking around you saying, oh crap, everybody else is doing well but me. So it's unbelievable.
The combination of the knowledge that I've gained, the excitement with which Dr. Huber and Chelsea have taught us, I think have been really important for me.
My kids are still working on, getting that sugar out of their system as well, but I can see a change in their lifestyles already just because of the changes that I've made in what we have in the house versus what we had in the house before. So hopefully I'm planting those seeds with them so that they can have a much healthier lifestyle as well.
So you got to be asking yourself, well, what is this magic program you have, Dr. Huber? It's called our Virtuoso Wellness Program, right? It's a 6-month engagement. We're going to pre-select metabolic syndrome patients.
So I'm going to be on your campus, on site every single week for the first 3 months and then every other week for the 3 months after that. We do weigh in, we do a presentation, you can call it a lunch and learn, but it more, again, is that group dynamic. We are talking, we are working together as a team. We do grocery store tours, which is my favorite. So we actually, all of us will meet at a local grocery store. I walk through the aisles and I actually show them how to put a meal together, how to read a food label.
And you think you know how to buy groceries? You don't, right? So we're going to help with that. We're going to do a cooking demo.
Yes, a cooking demonstration, because again, I can't just sit in an office and say, oh yeah, go buy this and cook this and put it together. I need to show you how to do it. So we are going to actually get our hands dirty and cook together, which is really fun.
We're going to change the way you think. We're going to change the way you process. We're going to do our mind-body mission, which is several engagements where we dig into why do you make the decisions you make and how do you change disabling beliefs that you own and install more empowering beliefs for actual change.
The results have been amazing. I mean, we take groups, and those 10 people have friends, they have co-workers. So all the results that are happening, all the changes in these people's lives, it's just like waves in a pond. We're in the hundreds of thousands of dollars of savings of people coming off of medications. Our whole company has gotten behind this, and they really like it, and they're interested. 350 people came to hear his last lunch and learn that we had.
You got to be ready to engage by now. So if you want to reach out to us, have a conversation about how we can affect your corporate culture and your corporate health, let's sit down with your chief financial officer who would love to talk to us, your human resources person. Let's figure out what we can do to make your company the healthiest in the city. Take care.